Have you ever heard the name Dorothy Johnson? What about the theory entitled Behavioral System Model of Nursing? If not, then don't worry. Today, we are going to discuss about this important theory, which was considered as one of the greatest theory that have contributed so much in the theoretical thinking about nursing and have been widely used up until now, especially in understanding the behavior of the patients and its effect on their overall health. But first, it is important for us to know the person behind this amazing theory. And without further ado, let's start. She is considered as one of the greatest nursing theorists who developed the behavioral system model. Her theory defines nursing in general as an external regulatory force who acts to preserve the organization and integration of patients' behavior under conditions wherein their behavior constitutes threat to their health physically or socially, or where illness is found. She was born on August 21, 1919 in Savannah, Georgia. She was the youngest among her 6 siblings. Her father is a superintendent of a shrimp and oyster factory, while her mother is a very involved and enjoyed reading. In 1938, she finished her associate's degree at Armstrong Junior College in Savannah, Georgia, and due to the Great Depression, she took a year off from school and became a governess and a teacher of 2 children in Miami, Florida, where she began realizing her love for children, nursing, and education. In 1942, she began her professional nursing career. It is when she graduated from Vanderbilt University School of Nursing in Nashville, Tennessee. She was a top student and received the Vanderbilt Founders Medal. In 1948, she received her Master's in Public Health from Harvard University in Boston, Massachusetts. After graduation, although she was a staff nurse at the Chatham-Savannah Health Council from 1943 to 1944, her professional experiences involved mostly in teaching. She was an instructor and an assistant professor at Vanderbilt University School of Nursing. From 1949 until her retirement in 1978, when she also moved to Key Largo, Florida, at the University of California, Los Angeles, she was an assistant professor of pediatric nursing, associate professor of nursing, and a nursing professor. In 1955 and 1956, she was a pediatric nursing advisor at the Christian Medical College School of Nursing in Vellore, South India. In 1965 to 1967, she was a chairperson on the California Nurses Association or CNA committee that developed the position statement on specifications for the clinical specialist. She was known for her behavioral system model of nursing, which was first proposed in 1968. Her nursing model states that each individual has patterned, purposeful, repetitive ways of acting that comprises a behavioral system specific to that individual. It advocates the fostering of efficient and effective behavioral functioning in the patient to prevent illness. The patient is defined as a behavioral system which is composed of 7 behavioral subsystems, namely affiliative, dependency, ingestive, eliminative, sexual, aggressive, and achievement. Each subsystem also comprised of 3 functional requirements, which includes, first, protection from noxious influences, 2. Provision for a nurturing environment, and 3. Stimulation for growth. An imbalance in each system results in disequilibrium, where the role of the nurse will come into action, which is to maintain the patient's equilibrium. Equilibrium refers to the state of having physical balance. where opposing forces or influences, which is the bad behavior, are balanced or being minimized to achieve stability. Dorothy Johnson was a prolific writer on the subject of nursing theory. She had published 4 books, more than 30 articles in periodicals, many papers, reports, proceedings, and monographs. 2 of her many works includes Theory Development What, Why, How, and Barriers and Hazards in Counseling. Her 1968 paper entitled One Conceptual Model of Nursing is a classic contribution to nursing literature. Her publications influenced so much in theoretical thinking in nursing during the second half of the 20th century. She held a strong conviction towards continuous improvement of care as the ultimate goal of nursing. Out of her many honors received, she was the proudest in her 1977 Lulu Hasselblad Distinguished Achievement Award from the California Nurses Association and the 1981 Vanderbilt University School of Nursing Award for Excellence in Nursing. Before her death in February 1999 at the age of 80, she reported that her greatest source of satisfaction came from following her students' productive careers, and she was greatly pleased that her theory has been found useful in furthering the development of theoretical basis for nursing and was being used as a nursing practice model on an institution-wide basis.
According to Johnson, when the behavioral system has balance and stability, the individual's behaviors will be purposeful, organized, and predictable. What do you mean balance and stability? It's all about a state of equilibrium. What is equilibrium? A sense of balance. So everything in our body should be in a state of equilibrium. If we alter this balance, it will result to disease. More or less, it trigger and it will result to attention. Concept of nursing. Dorothy Johnson's theory defined nursing as an external regulatory force which acts to preserve the organization and integration of the patient's behaviors at an optimum level under those conditions in which the behavior constitutes to a threat to the physical or social health or in which illness is found. So according to Dorothy Johnson, the nursing goal is to preserve the organization and integration of the patient's behaviors. Our behavior when there is imbalance in our body or when our equilibrium is disturbed, how to manage it? Nurse role is to help our patient to bring back into a state of equilibrium, especially when there is threat, physical or social health. So, we have to preserve or to bring back the balance and stability. Dorothy E. Johnson is well known for her behavioral system model, which was first proposed in 1968. Her model was greatly influenced by Florence Nightingale's book, Notes of Nursing. It advocates fostering efficient and effective behavioral functioning in the patient to prevent illness and stresses the importance of research-based knowledge about the effect of nursing care on patients. She proposed that nursing care facilitates the client's maintenance of a state of equilibrium. Nurse role is to maintain the state of equilibrium. That is our job as a nurse. Now, what if it imbalance? The patients are stressed normally. This is triggered by a stressor. There is a stimulus of either an internal or external nature. there is someone who interrupts your state of balance. Clients are stressed by stimulus of either an internal or external nature. An example of internal stimulus internally can be such you cannot breathe normally because of it clogs your airway passage, the mucus or phlegm. Or you ingest a food that trigger your allergy, or you ingest spoiled milk, it may result in diarrhea. Or you have toothache. In short, internally, there is something causing disturbance or imbalance inside of our body. Second is the external stimulus. For example, you have an enemy, your friends, or nobody recognize or appreciate your hard work in your workplace or even in your family. That can create stress. And now, I will ask you, what is your stressor that might affect physically, emotionally, and psychologically? These stressful stimuli created such disturbances or tensions in the patient that a state of disequilibrium occurred. So, Dorothy Johnson taught us don't make disturb our equilibrium because it will lose our focus. It will affect our performance, it will affect how we do things, and can lead to attention once if we will not bring back the state of equilibrium. Human beings having has two major systems that we need to balance: biological system and behavioral system. In biological system, it is the rule of medicine focuses by doctor. The doctor address such as if something happened to your body, like you cannot breathe well, you have diarrhea, or any biological problems. The focus of balance under biological is the doctor. Whereas nursing's focus is the behavioral system, such as on how we respond, how we react, how we behave. For example, the patient have headache, so nurse rule is to provide an intervention, is to rest in a quiet and relax your patient. Perform hot or cold compress to his or her head or neck. Promote, meditate, and pray to be able to relieve patient headache. And that's the behavioral response of nurses on that certain problem. This is what Dorothy Johnson taught us on how to respond in tension to be able to maintain the balance or equilibrium. Equilibrium, state wherein the person is in harmony with himself and with his environment. Meaning equilibrium is a state of balance if physiologically when our body in a state of balance called paired of homeostasis in anatomy and physiology. And who making disturbance our state of equilibrium. This is we call the stressor. It can be external and internal. And once we have stressor, it produces tension. And once we have tension, that's the time of nurse's role to perform the services needed is to assist the patient to return to a state of equilibrium. And now, how we will help our patient to return back to a state of equilibrium. There are two areas of focus to return the patient to a state of equilibrium. First, reduce stressful stimuli. During assessment, we should know first what is the stressor of patient by doing open and ended question. Identify what are the causes of having you attention. So the first nurse rule is you have to reduce stressful stimuli. Second, support natural and adaptive processes. If we cannot remove stressor, there's no way to do but is to adapt and learn to cope. what we can do is to move forward. This is the behavioral system model of Dorothy Johnson. First is the stressor, and this stressor would affect our behavioral system. And this behavioral system is divided into 7 subsystems: attachment or affiliation, achievement, sexual, ingestive, eliminative, aggressive, and dependency. Once the stressor enter and trigger these 7 subsystems, will let affect function as a result of tension. Here, we have the original Dorothy Johnson's behavioral system model. As you can see, everything starts here in stress tolerance flexibility. Then, there is external stressors or internal stressors. So, this stressor would affect our behavioral system. These 7 subsystems: attachment or affiliation, achievement, sexual, ingestive, eliminative, aggressive, and dependency. Once it affected by the stressor, the result is tension, meaning it triggers our balance. Once we have tension, this is now the cue of nursing action. Nurses has to return back the patient tension into a state of equilibrium. What nurses going to do is to nurture, protect, and stimulate these 3. It will activate once there is tension. Then the arrow going down to equilibrium, which is our main goal. Then to activate dynamic behavioral system, and the end to make positive back our negative stressors. Once it's positive, it already returned back to a state of equilibrium, our tension. Going back to the model, again, once there is stressor, not all of the subsystem will affect. It will concentrate only in one subsystem. Example, it affect the ingestive or eliminative, but possible can affect other subsystem. And once it's severe, it will affect whole because this same like our human organ system. So when there is an alteration in the equilibrium that exists, this model tends to diagnose to a subsystem. This model states that it is at this point when the nurse is needed in order to return the patient to homeostasis.
The major assumptions in Dorothy Johnson's theory are the following. Nursing. Nursing is an external force that acts to protect the organization and interrogation of the patient's behavior to an optimum level. The nurse may perform temporary regulation by giving resources while the patient is experiencing stress or imbalance in the system. Person. There is organization, interaction, interdependency, and interrogation of the parts and elements of behaviors that go make up the system. A system tends to achieve a balance among the various forces operating within and upon it, and that the man strives continually to maintain a behavioral system balanced and steady state by more or less automatic adjustments and adaptations to the natural forces occurring on him. A behavioral system which requires and results in regularity and constancy in behavior is essential to man. It is functionally significant because it serves a useful purpose in social life and in individual. System balance reflects adjustments and adaptations that successful in some way and some degree. Health is influenced by biological, psychological, and social factors. It is reflected by the organization, interaction, interdependence, and interrogation of the subsystems of the behavioral system. Balance in the system will lead to a functional behavior, while lack of balance in subsystems will lead to poor health. Environment. The behavioral system determines and limits the interaction between the person and their environment and establish the relationship of between person to the object, events, and situation in the environment.
Attachment or affiliation subsystem. What do you mean attachment? It is when people needed the feeling of attachment or feeling of belongingness because psychologically we needed this. It forms the basis of all social organization. It provides survival and security. Survival meaning we cannot survive alone. No man is an island. Because attachment, we use this in our relationship with other people, and we need people to feel the sense of security, especially children. They need attachment to survive. For adult, we have attachment and its consequences to social inclusion, that we feel belongingness in a family. Sometimes you have stressor in a family or in a group of friends, so we need social inclusion and intimacy, like having a partner, and formation and maintenance of a strong social bond. Example, allowing family members to visit patients can help patient to return to the state of equilibrium. Achievement subsystem. Control or mastery of an aspect of self or environment to some standard of excellence. This standard of excellence is very important for us. As a person, there's an aspect in our life where we need to excel because it will boost our confidence and our personality. It may be intellectual, physical, creative, mechanical, and social skills achievement. Example, giving positive feedback such as praises after completing a task. Question subsystem. This is all about we eat. When we eat, how we eat, what we eat, how much we eat, and under what conditions we eat. When you eat, it's 3 times a day. If you lack it, can be a malnutrition. If eating too much also causes obesity. How much you eat means how fast you eat. What you eat should complete the 6 nutrients: carbohydrates, fats, proteins, vitamins, minerals, and water. How much food you eat, small but frequent, like every 3 hours. It's better to be healthier. Under what conditions we eat? Example, you eat more because you are stressed, which is not good example. It is an emphasis on the meaning and structures of the social events surrounding the occasion when the food is eaten, and has to do with when, how, what, how much, and under what conditions we eat. Example, considering patient preferences in food choices. We need to ask the patient about his or her food choices as long as not prohibited to the patient condition. Be a partner of that plan. Elimination subsystem. Elimination means excretion of waste, even our sweat glands. When do you eliminate? Eliminate every morning. Make it a habit because it is very helpful and healthier practice. Please advocate our patient. How do you eliminate? Over waste elimination is not okay. Over urine elimination is not okay. Small amount output is not okay also. The output of elimination should be in a state of equilibrium. Example, promoting regular bowel elimination. Promote regular bowel elimination every morning, which is very helpful, and drinks warm water every morning. It helps in peristalsis. It fasts when it exposed to warm water. It makes our intestinal movement feel good in order to avoid constipation. Aggressive subsystem. This is not an aggressive violence, meaning we have to be aggressive, and it is important for protection and self-preservation. Example, if there's a threat physically, we have to defend ourselves to protect ourselves. When a patient refuses to take the medication as he thinks it's more harmful to him and the nurse explains it to him, patient has a right to refuse because the medication can be harmful in his condition, just as he is protecting himself. Dependency subsystem. This is all about promoting helping behavior. This dependency means this needs is depending to the other people and is not our control, and sometimes if things are not going our way, it can frustrate or disappoint us. Therefore, we need to ask other people opinions. For example, seek approval from the other people. We cannot approve ourselves. We need to get approval in our parents, especially when you are in adolescent or minor age. This is like affirmation. If someone gives you approval, it gives you also attention or recognition from people around you. For example, giving approval, attention, or recognition, and physical assistance. Sexual subsystem has intended to two dual functions of procreation and gratification. Procreation means is to multiply our human race, and we need sex gratification. This is physiological needs according to Maslow needs. Aside of this, it includes our gender role identity. Another is the sex role behavior. For example, promoting a mother perform her maternal role in the sexual subsystem.
Nightingale's book, Notes on Nursing, heavily influenced Johnson's behavioral system model. In her model, Johnson's made a premise that nursing was a profession that made a distinctive contribution to the welfare of society. Meta paradigm. First, person. Johnson views a person has two major systems, the biological system and the behavioral system. It is the rule of medicine to focus on the biological system, whereas nursing's focus is on the behavioral system. The person as a behavioral system has patterned, repetitive, and purposeful ways of behaving that link the person to the environment. Behavior systems are specific organizational structures of cognitive components known as behavior mechanisms, perceptual, central, and motor. As a result, behavior systems are characterized here in structural terms rather than functional terms. Second, health. Health is reflected by the organization, interaction, interdependence, and integration of subsystem of behavioral system. Johnson's behavioral model supports the idea that the individual is striving to retain some balance or equilibrium. The third is environment. All forces that affect the person and that influence the behavioral system. These factors can affect behavior. Physical factors, age, health, illness, pain, influence of a substance or medication, personal and emotional factors, the personality, beliefs, expectations, emotions, and mental health. Life experiences, including family, culture, friends, and life events, also of what the person needs and wants. And the last is nursing. The primary goal of nursing is to cultivate equilibrium within the individual, which allows for the practice of nursing with individuals at any point in the health-illness continuum. Promotion of behavioral system balance and stability. The behavioral system model is a nursing care approach that promotes the development of efficient and effective behavioral functioning in patients in order to avoid sickness.
Case scenario. Ronell is a retired 60-year-old man. He had a successful business and considers it as his achievement. He would like to enjoy his retirement, so just sold his business and became active in volunteer organizations. He has lived with his wife for 40 years. He has 3 married children and 6 grandchildren. He is satisfied with his family and he is enjoying his grandchildren. His both parents have diabetes. Ronell has a 2 years history of type 2 diabetes. He was diagnosed in 2019, 1 year before his diagnosis. He had records of fasting glucose values ranging 120 to 130 mg deciliter, indicative of borderline diabetes. He remembered previous episodes of nocturia after large rice meals and desserts. That time, he was advised to lose weight, but no action was taken. He was referred by his family physician to diabetes specialty clinic. Ronell presents recent weight gain, poor diabetes control, and foot pain. His medical records show that his HbA1c is always greater than 8.0%. His blood pressure is 150/100. He stands 5 feet 4 inches and weighs 185, resulting in a BMI of 31.8 kg/m². Hi Ronel, I'm Mika. I'm your nurse today. How may I help you?
Hello, nurse. This is Bridget, my wife. I was advised by my family physician to seek help in this clinic. My doctor told me that my A1C is always above normal. I stopped taking my medicine for blood glucose, glyburide 2.5 milligrams every morning
Why did you stop taking it?
because I feel dizzy after taking it. It's not working well for me.
Do you check your blood glucose levels at home?
I don't do that. Checking it will not improve my sugar level. I will stay high. I am diabetic.
You are right. The glucometer will not improve your sugar levels. However, it evaluates the effectiveness of the medicine and dietary changes in lowering your blood glucose level. Keeping the blood glucose levels in control will prevent the development of complications of diabetes.
At first, I will lose 3 pounds, then after some time, I will regain it. I also feel that I'm getting heavy every week in the past year. I gained 25 pounds. This is unhealthy and embarrassing.
My husband is physically active. We walk in the neighborhood every morning for at least 20 minutes and we do gardening in the afternoon. I encourage him to be active because I want him to lower his cholesterol and blood sugar level.
That is good. Physical activity can help lower blood sugar and cholesterol. How about during cold weather? How do you exercise?
I do not walk outside during cold months. I just realized that my exercise is seasonal. I will lose weight in summer and regain weight in the winter.
Maybe it's time to buy a treadmill so you can still have exercise during cold weather.
That's a great solution. Do you have any problems with your elimination patterns?
Before I was diagnosed with diabetes, I experienced frequent urination even at night. After I urinate, I will feel thirsty. It doesn't bother me because whatever I eliminate, regain it by drinking. When I was diagnosed with diabetes, I learned that it was a sign that my blood sugar is high.
Yes. Those are signs of blood glucose together with feelings of hunger that urge you to eat, feeling of getting tired easily, weight loss without even trying. Can you describe me your usual meal?
For breakfast, I eat 2 slices of bread with coffee. For lunch and dinner, rice with meat or fish. There are times I eat rice during breakfast. I eat rice every meal. It is in our culture to serve it almost every meal. I also eat desserts like pastries or sweet desserts after lunch and dinner.
Do you drink alcohol?
Occasionally,
How about your snacks? Can you please describe it to me?
I eat snacks in the morning and afternoon. I usually eat fruits or bread. I know that my diet affects my blood sugar level, but I don't know how to change my diet. Our food is usually high in carbohydrates.
I understand that the food in your culture consists of high carbohydrates. You can start by reducing the portion size by one third of every meal. It seems that your main concern is to lose weight.
Yes, we think that losing weight will lower his cholesterol and blood sugar level.
Yes, it could help. I will refer you to a dietitian to help you manage your diet in improving your blood sugar. Based on my assessment, we also have to address your husband's hypertension. The doctor will talk to you about it.
That would be great.
Thank you.
Ronell agreed to start improving his diet by reducing portion size by 1/3. The nurse knew that weight loss could also improve his blood pressure. The nurse contacted a dietitian for nutrition therapy focusing on weight loss and improving diabetes control. Ronell's appointment will be next week. The dietitian advised the patient to keep a food journal. He must record all his food intake every day. The nurse also taught Ronell and his wife the importance of foot care. She explained that with diabetes, there is a loss of protective sensation, and he needs to frequently check his feet for any skin lesions caused by poorly fitting footwear. Hi, Ronell. I'm Dr. Vilya. How are you?
Hi, Dr. Bilya. Could be better.
Based on your record, you have poorly controlled diabetes, high blood cholesterol levels, and you also have hypertension. I will prescribe you with metformin 500 mg twice a day. This medicine will help lower your blood glucose. You also have to use a glucometer twice a day.
Yes, I will use glucometer. The nurse taught me and my wife how to use it. I also learned that it evaluates the effects of the medicine and the dietary changes on my blood glucose.
That is good. For your hypertension, I will prescribe you an antihypertensive drug.
I do not want to take a lot of drugs. Too many will make me sick. I believe that a natural solution is better than medicine in treating my blood pressure.
I understand your decision. Weight loss and diet modification can help lower your blood pressure. We will monitor your blood pressure for now.
Thanks, Dr. Villa.
The nurse knows that metformin has possible gastrointestinal side effects and the patient needs to avoid alcohol. He told the patient to take the medicine with food to reduce side effects, and the patient also agreed not to take alcohol while taking the drug. At the end of the visit, the nurse assured the patient that she will share the plan of care to the healthcare team. She will also work with the dietitian to reinforce the nutrition therapy in improving his blood glucose control. After the clinic visit, Ronell started to modify his lifestyle. Ronell, with the support of his wife, followed the treatment regimen to improve his condition. He takes his medicine for diabetes and cholesterol. He now monitors his blood sugar levels twice a day. He has a treadmill at home and still continues to be active physically. He also follows the diet advised to him by the dietitian. After 3 months, Ronell noticed that his clothes were getting loose and he felt more energetic. His blood sugar monitoring results are getting stable. He is happy with the results of his new lifestyle. He believes that when he comes back to the clinic, he will have good results from his diagnostic tests.
Good afternoon, everyone. Arnold Taliserna, BSN 1C. Johnson's Behavioral System Models by Dorothy Johnson. So here are the 7 subsystems of behavioral system models. Number 1, attachment or affiliative subsystem. Number 2, dependency subsystem. Number 3, ingestive subsystem. Number 4, eliminative subsystem. Number 5, sexual subsystem. Number 6, aggressive subsystem. And number 7, achievement subsystem. 7 subsystems of the behavioral system models. Number 1, attachment or affiliative subsystem is the social inclusion, intimacy, and the formation and attachment of a strong social bond.
Nurse,
Yes? Yes, ma'am!
asa ang watcher?
Alaban ako sa gawas, ma'am. Watcher ni Malahos. Sige, sir. Sulod, sir. Ma'am, ari mong watcher, ma'am. Mong bana. Number 2, dependency subsystems is the approval, attention, or recognition and physical assistance. A certain amount of independence is essential for the survival of social groups.
Nurse, need help?
Yes, ma'am! Putindad ka? Number 3, ingestive subsystem. It is emphasis on the meaning and structures of the social events surroundings, the occasions when the food is eaten.
Nurse, igutom po.
Ay, sige ma'am. Ari ma'am. Number 4, eliminative subsystem. Human cultures have defined different socially acceptable behaviors for accretion of waste, but the existence of such patterns remain different from culture to culture.
Nurse, kasukaon ko.
Number 5, sexual subsystem. It has a dual functions of procreations and gratifications, including but not limited to courting and mating. This response system begins with the development of gender role identity and includes a broad range of sexual behaviors.
Ma'am, mga din yung baby, ma'am.
Thank you, sir. And number 6, aggressive subsystem. It relates to protections and self-preventions generating a defense response when there is a threat to life or territory.
Ma'am, ano yung mga tambal, ma'am? No.
And lastly, 7 subsystem of the behavioral system models. Number 7, achievement system. It provokes behavior and tries to control the environment, and it attempts to manipulate the environment, and its function is to control or mastery as an aspect of self or environment to some standards of excellence.
Nurse, salamat kaayo ha.
Salamat kaayo, nurse.
Okay lang kayo, ma'am, sir.
Thank you kaayo.
Okay lang, ma'am. Ay, sige, ma'am.
Johnson's theory has become quite popular in the medical environment and has generated various types of research, including multiple analyses of its effectiveness, as well as possible modifications in the algorithm of nursing care. It generated various qualitative studies on the usefulness of its implementation in comparison with other nursing theories. One of these studies was conducted by Aurora, who considered this model in connection with other theories and evaluated its effectiveness and the possibility of application in modern conditions. The results of the research confirmed that Johnson's concepts are relevant and can be used as one of the methods of complex treatment of patients' behavioral disorders. The strength of the model is the possibility of its application for a variety of cases, including both severe behavioral disorders and less severe depressions. Moreover, Johnson's theory allows nurses to assess the psycho-emotional state of each patient thoroughly and draw the right conclusions based on the information obtained. Occurring in 2014. Perhaps its only weakness is that it is suitable for treating behavioral problems and cannot be used in other cases. The effectiveness of Johnson's system model is proved in practice. Theory is useful and relevant and can be applied in various medical institutions, for patients with some behavioral disorders. The concepts are testable and have been a basis for scientific research. The practical benefits of the model are manifested in various advantages and can be of considerable help in the nursing care process. The implementation of the theory helps to achieve particular professional success and gain recognition among patients.